The key question, and the reason I think we're interested in measurable residual disease in AML, is we want to be better doctors. We want to see the patient in front of us in remission and know what the right thing to do is for them. One of the issues we have at the moment is the technologies we use to measure MRD are really split into two camps. If someone's got a molecular mutation we can track, the Irlen guidelines are we should use one of the quantitative PCR tests for one of those patients. So core binding factor patients, someone with an NPM1 mutation, we know what to do. We should track them with qPCR. For everyone else, we use flow. And those techniques have advantages and disadvantages. One disadvantage of flow cytometry is it really needs real expertise to interpret it. And not all centers have a real expert in flow cytometry. qPCR, in contrast, is really quite straightforward to do, but is only for a subset of patients. And so what we're really looking to do, can we get a panel, and this is the hope with next generation sequencing, we could have a broad single test that can be used for any patient with AML. We know that with DNA variants, perhaps 85, 90% of patients will have a DNA variant that could be got with conventional next generation sequencing. But it seemed to us there was a huge opportunity there where perhaps 40% of patients have a mutation that can be tracked by PCR, and could we put that into a sequencing platform? I think the end goal we'd like to reach for is we have one test that we can use on every patient with AML, and we could use that universally throughout trials and then start to compare data across trials. And so the RNA sequencing-based test we made really took those very well validated qPCR tests and put them into an RNA sequencing platform. That required some modifications to RNA sequencing. Regular RNA sequencing isn't going to work for that. But we found a way to increase the sensitivity of the RNA sequencing probably by 100-fold over regular RNA sequencing. And I think that's at least equivalent to qPCR that we would currently use. So we hope that's going to be integrated in a one-size-fits-all sequencing test for AML in the future.